So we talk about a condition known as DDH, that is developmental dysplasia of hip. Now in this animation, as we can see, the left hip joint is out of socket. The ball of the hip doesn't stay in the socket inside the womb of the mother. When the baby is born, the hip, which is normally supposed to be aligned with the socket, that is the acetabulum, is not in place. And if such a child is not treated, when the child starts walking, the forces will not be going to the socket. Now, this is the condition known as DDH, where the ball is lying outside. Now, this is one of the child, 3 years of age, came to India for DDH treatment. You can see both the hips are out of socket. This is how she is walking. It's like a duck gait. The child is walking with a swaying on both the sides. The shoulders are dropping on both the sides. So you have taken under anesthesia. This is how we anesthetize the child. Special equipment, special techniques. This is how the child is prepared for surgery. This is how she is lying on the OT table. We prepare them. We examine under anesthesia before we start our surgery. Now, if you see, as we move the hip, it goes out, it goes out, it goes in, and as we turn the knee inside, it goes out again. It's a highly unstable hip. Now, if you see the animation of the surgery, if you see carefully, we need to release the muscles the way it is shown here in the video, the muscles on the inner side, and then we open up the hip using a special bikini incision. The hip joint is open up, the muscles are released, the covering of the hip joint, the capsule is released, the ball is identified, all the obstructions are removed. Then we make a cut on the thigh bone. This is to rotate the thigh bone because in these children they are usually excessively rotated. This helps to put the ball in and prevents further dislocation. Now we need to deepen the socket as well. As we can see here, the socket is shallow. We make a cut in the pelvis bone and put this bone inside. This helps to increase the cover of the femur head and makes the socket deep. Now we repair the capsule, water sealed cover, and this is how the hip looks under anesthesia. These two wires are left in to be removed after 6 weeks. The child is happy on the first day of surgery. This is how we apply the plaster. She can be carried in the arms. Now we have operated the other side after 2 months. This is the left side surgery. Now as we can see here, this is almost 3 to 4 months after both hip surgeries, and we are examining the child under anesthesia. The hip is now perfectly stable. You can see the movement in the radiology. The hip is well centered inside the socket. The ball is not going out. The fluoroscopy clearly shows that the hip is stable. Both the hips are completely stable, and despite push, the hip is not going out. So we gave the child a final plaster after examination under anesthesia. We removed the wires, and this final plaster, which is known as the half band spica, remains for about 6 weeks. This is how the hip looks after complete treatment. Both the hips are inside socket, well centered, stable, does not go out, and the cuts in the bones have all healed. We do not see any residual cut in the bone. Here we did not do a femur osteotomy. Now after the surgery and the recovery time, once the plaster comes out, the child is given a special brace, and the child, as you can see here, is crawling with the brace, and we allow them to stand on the brace. What happens is, over a period of time, the child gets muscle strength and they are able to walk with the belt on. The belt basically puts the hip ball deep inside the socket and maintains that while the child is learning to stand and walk. This is how the child learns. As she gets stronger, her walk becomes better. So the belt is basically worn for around 6 to 9 months till we see good consolidation of the bone of both the hips and development in the size of the femur head. Gradually, the child learns to walk straight, completely straight, without any pain, without any limp, which we saw before surgery. Now the child is now 2 years post-operatively, and as you can see, can do most of the activities without any perceptible limp or pain. is happily doing all activities. So this is how we attain good outcome in a child with DDH, both the sides out of socket, both the hips, and both the hips are now stable. This is how treatment of DDH is done surgically.